A diabetes medication gained a lot of popularity recently as a new weight loss drug.
It's being called a miracle, and joining us to talk a little bit about this is Fox 5's medical contributor, Dr. Richard Chaffoux. We're talking about Ozempic.
Right.
Dr. Chaffoux.
Right.
It's a semaglutide, an injectable that is normally used for people with diabetes. It helps them with their blood sugar. So what is it exactly, and is it for all types of diabetes?
Sure. So it's primarily, Maria, for the type 2 diabetic. And type 2 diabetics are those that tend to get diabetes a little bit later on in life. It's more easily controlled. And unfortunately, it affects, over 30 million people in the United States. So it has a huge impact. And the way that it works is that essentially it's what we call a glucagon-like peptide, or GLP-1. And the way that it works is it actually when we have food and when the blood sugar goes up, the gut and the CNS both release GLP-1. GLP-1 then travels to the pancreas and assists the pancreas in releasing insulin to control blood sugar. So it can have a significant, very positive effect. And so it's been used in that group of people. But there's interest, as you said, in it as a weight loss drug, because what's interesting is that it also affects the brain centers that are responsible for eating, for the sense of being hungry. And so when it stimulates those areas, it actually causes a sense of being full, so being satiated, not being necessarily
So it's not necessarily
hungry.
Creating a way for you to lose weight. It's just telling your brain you don't need to eat more?
Exactly, because that's one of the main centers that drives us to eat. Not only when we're hungry, but when we're nervous, when we're anxious. We tend to, many of us, including myself, tend to eat more, right? So if we have a drug that can work and affect that center on the brain that's responsible for that, then we can see a weight loss. But experts tell us that we need to be careful with this because it doesn't work in everybody. And once you start a medication like this, it's something you need long term. Now, there are newer drugs coming down the pike, so Ozempic will probably get replaced by, many other generations as many medications have over time. And we're seeing a variation in the weight loss. So averages maybe 12%. But we've seen people, up to 30 to 35%, but there are some non-responders.
This is 35% of your body weight?
Yes.
Wow.
So it can be significant. And so, but it's only part of an overall plan to lose weight. So it doesn't take the place of, being careful what types of foods you choose, being active, being, in a good exercise program, talking to a nutritionist about having a balanced, healthy diet.
They call it a miracle, but it's not going to do everything for you. It's just a tool.
No, it's not that easy.
Exactly.
It's one of the few things that we have, right?
Obviously they use it for diabetes, but is it safe for people to use it for weight loss? So
under good control, obviously under a physician's guidance, and there is some interest now that it may have help us in certain addiction. And there are some animal studies that seem to indicate that it can be used to diminish our tendency to be addicted to drugs. Things like, there are some studies that seem to indicate that people that were taking nicotine patches, and they compared that group with people that were taking the nicotine patch and Ozempic, they found those people that were taking that combination did a better job at not actually continuing smoking, getting off cigarettes, because we know that there is an addictive center in our brain, and it's part of where GLP-1 works to stimulate that, and then we release dopamine. And dopamine is one of our happy chemicals that we want. So this addictive personality, GLP-1 is thought to block the release of dopamine. And so it eliminates a reward center, because people that have addictive disorders, people that are drug addicts, there's that sort of reward center that continues to be stimulated, and we think that there may be interest in that actually blocking the release of dopamine and maybe making it more effective for people to lose addiction.
Kind of tricking your brain to say you don't need more.
Yes.
Either it's food or it's alcohol or drugs or smoking, that sort of thing. So was that ever the intent when they created this, that was something that would come out of it? And also with that in mind, are there side effects that we're learning about that they didn't know about initially?
Yes, and there are some side effects, diarrhea, vomiting, nausea, Constipation can be a significant problem. And that wasn't the initial intent, of course, because it was to treat, diabetics. But it's with so many medications that we come across, the more that we study and we look at it, we see some side effects or benefits, much as like initially, for example, Rogaine was an antihypertensive agent, but it had side effects, and there were all these middle-aged guys like myself that were, beginning to get hair back in the crown, and they were like, oh, wait a minute, this is another idea. So the company switched focus. So this is what happens. A lot of our discoveries in medicine just happen to be just by happenstance, by accident, but a positive way. So it's exciting because this will be more research and interest in not only dealing with obesity, which affects about 36% of the U.S. population, but addiction, which can be, just destroy people and their families, have a huge ripple effect in the community.
And penicillin, kind of accidental discovery?
Yes.
Jonas Salk?
Yes.
Pretty good. That worked out pretty well.
Worked out pretty well.
Yeah.
We do have to point out that it is expensive, though, if you do.
Excellent point. And unfortunately, Maria, insurance companies are not covering the cost of this. Now, what's interesting, they will cover the cost of a nutritionist. But if you think about the healthcare expenditures of somebody that's overweight, that needs to be on medications, that may have, heart disease and hypertension that's related to obesity, it seems to most of us that that think logically that it would be worth their while to invest in that versus spending money on the other end, which can be even more money for treating these illnesses that are, somewhat of a direct result of obesity.
Proactive instead of reactive.
Yes.
All right, that argument could be made. Dr. Sheffu, thank you for the insight. We always appreciate it. Great to have you here.
Good to
Thank
hear.
you.
All right.